There's your day in headlines for Friday, October 17th. Day in headlines in 1 minute, that is. Glad to have you along here, Richard Pyatt Show Friday on WBCK. Joining us in the studio this half hour is Dr. Gregory Harrington, Bronson, Battle Creek. Also happens to be the Calhoun County Chief Medical Officer. We're going to talk about Ebola and flu, both here in this half hour. Doctor, thanks for the time today.
Good morning.
We had intended to talk exclusively about flu, but with all this Ebola talk, it seemed that we ought to address that first. And, I think a lot of us are approaching this notion that there's a lot being made of this in the media. So I'm curious about your reaction to it. Is it as big a deal as some folks may be thinking it is?
Well, it is a big deal in that it's a new organism in the United States. It's difficult to control if you don't pay attention. It's not a big deal in that it's a threat to every local community. It's not. Mm-hmm. In our local community, I would estimate the risk is low, primarily because we do not have an international hub of travel. And we do not have an indigenous population that reflects the people coming from Western Africa. Mm-hmm. So our chances of seeing this organism in the Kalamazoo Battle Creek area are low. I can't estimate zero, but low.
Mm-hmm. Now, having said that, there certainly are folks who live in our area who might trek off to Detroit, let's say, and grab an international flight and go somewhere. And certainly that's been some of the latest stories is that one of the folks being treated was on an airplane before her symptoms were diagnosed. Mm-hmm. So is that as distant a long shot as we might think?
Well, in theory, that shouldn't have happened. That person that boarded the plane had two criteria that should have prevented travel. Mm-hmm. One, she had contact with an active known case, a lot of contact being one of the nurses taking care of him. Right. And two, she actually had an elevated temperature. The problem you run into is the definition, the case working definition that the CDC has passed out throughout the country is an epidemiologic one. It's one to track. It's not one to substitute clinical judgment. Mm-hmm. So the advice she got to go on a plane with a temperature of 99.5 was not the right advice. She shouldn't have been on the plane. So that's one caveat or one example where my prediction would have faltered in the Cleveland area. I wouldn't have expected her to be on that plane.
And by virtue of that, we can perhaps expand that idea in saying this really doesn't happen that much, is what
No, I think that is a unique event.
Yeah.
If you think about it, what do we actually have for Ebola in the United States? Other than the two citizens that came back voluntarily and we were prepared for, you had one individual come in who developed illness here. And all the other problems that have developed were people taking care of him. Mm-hmm. So that's something that you have to keep in mind when you assess your risk. But I understand that people are saying, well, how is this going to affect me?
Right. Let's back up a second. What is Ebola anyway? And what are some of the symptoms of it?
Well, Ebola it's a virus. It actually comes from a family of viruses that are ancient, going back to the Mycene era. I mean, these are ancient viruses. It was first discovered in 1976 in the Democratic Republic of Congo, which at that time was Zaire. It was an unusual illness that had a very high mortality. It presented with flu-like symptoms initially in the first few days, but quickly evolved into multi-organ system failure. People developed cough, shortness of breath, muscle aches, diarrhea. And then as a part of that picture, they developed a syndrome that you can see with other infectious diseases where you have a hard time clotting your blood. And so they would get spontaneous bruising, would bleed or ooze from sites where they had blood drawn. Mm-hmm. They would near the end of their life, they would even see some blood in the stool or vomit. But what's unique about this organism is how infectious it is. I've seen mixed messages on the news. Oh. If you watch the news, depending on which talking head that's up there as an expert, most of which I've note that I'm not sure they actually are taking care of patients, but they have some expertise in the area. They give you a mixed message on how infectious it is, but it is a very infectious illness in terms of contact, touching the individual and coming in contact with body fluids. It's not spread by droplet cough, sneeze. It's not spread by simply breathing. That's not how this works. But it evolved in the sub-equatorial areas of Africa. And ever since 1976, we've had outbreaks here and there. There's 5 strains. The most bizarre one was the Reston Ebola, which is named after Reston, Virginia, which in 1989 infected a bunch of macaques that came from the Philippines. And they all had to be put down. 6 workers were infected, actually, but none of them became symptomatic. So that's kind of what the story about Ebola.
And so the way you describe that is certainly targeting a certain population and is consistent with the notion that those who have come in contact with it have been helping someone who has it. And that makes a lot of sense. The average person, it would be difficult to catch that at this stage.
Right. I mean, you really have to go out of your way.
Yeah.
If you're from the United States, going out of your way means boarding a plane and for some reason wanting to go to a third world country in Western Africa. I'm not sure why you'd want to do that. I don't see it as a vacation destination. There's no Disneyland there. Yeah. That's part of the problem with Ebola. It happens in places that are remote. I mean, really remote. I mean, these places don't have running water, electricity, very little roads. So you got to go out of your way to get this.
What's the treatment?
There is no actual treatment that's specific for the virus. The treatment we offer right now is supportive, and it actually is very helpful. It's intensive supportive care, I might add. These people have large fluid shifts. Their blood the blood volume is reduced. Their fluid outputs are high, and so you have to keep up with that. So it's supportive care. It's supportive care, giving lots of IV fluids, monitoring electrolytes, making sure they maintain their nutrition, monitoring their oxygenation, maintaining the blood pressure. That's what we have offered right now. That's what we have available. So it's intense nursing care. However, as far as treatment for the virus itself, there are experimental drugs that are in phase 1, 2, and studies right now. There are some direct-acting agents that are out there, actually, that are being studied. There's 2 vaccines that are being deployed. One from the U.S., one from Canada, one from the U.K. Russia just announced they're going to have a vaccine coming out in 3 months.
Okay.
So there are vaccines, and then there's what they're doing now. They're using antibodies from the survivors, that one of the physicians. That's actually a treatment.
Sure.
And they're infusing that into people who are actively ill.
We're talking with Dr. Gregory Harrington, Bronson Battle Creek, and Calhoun County Chief Medical Officer. A couple final thoughts on Ebola, and then we'll talk about influenza. Plain old flu. Boring subject, I guess, in comparison, but things we should talk about. That's coming up on WBCK 817. Dr. Gregory Harrington is our guest this half hour from Bronson Battle Creek, as well the Calhoun County Chief Medical Officer. And I suppose before we get to the whole discussion of flu, the other thing that's been in the news is the so-called D68 Enterovirus, and this is affecting children. Right.
Actually, in the big picture, in terms of healthcare and public health, Enterovirus, D68, and influenza are much more of a threat matrix to us than Ebola is. I want to make that real clear.
Yeah.
And we have something we can do about those 2 viruses. We've had 5 children that have died from D68, and we've had even a death here in Michigan. It's an organism that affects primarily infants and children. There's a bunch of these enteroviruses out there. This is not new. This one was discovered in 1962 in California, so this is not new. What's interesting about it is, and we don't understand why, is all of a sudden it's much more airborne, respiratory. Enteroviruses typically are in the GI tract. An enterovirus that people are familiar with, it's polio.
Wow.
Polio is an enterovirus. Other enteroviruses can cause illness, typically encephalitis, meningitis. This one in particular causes respiratory symptoms, and it seems to be spread that way too, which makes us unique. So this is kind of a new twist on this organism, and we don't quite know why. There's no treatment for it. There's plenty of preventative measures, but when your children get respiratory illness that's flu-like, runny nose, sneezing, cough, body aches. That could be enterovirus, D68. It doesn't mean your child's going to have a serious illness. These are rare cases in terms of mortality. But if your child has asthma, they typically have a more severe event. They might have much more severe respiratory symptoms and get hospitalized.
I see. And why do you suppose this suddenly has become more respiratory? Is this just an evolution of this particular virus?
Well, that is the question.
Yeah.
We don't know why. It could be a mutation in this virus. It could be a strain that's evolved, and that's my suspicion, but we don't have concrete reason at this point.
I see. Okay. So if a parent is seeing these kind of symptoms, to the doctor they should go.
Well, especially if the child has asthma. There's no specific treatment. So it's not as though the child is going to end up having a poor outcome. And there's other viruses out there that can do this. We're entering a season now where you can mix up D68 with rhinovirus and other viruses that can make your child just as ill. I think the key is not to be alarmed, and you can do things like, wash your hands, avoid touching your eyes, nose, and mouth with unwashed hands, avoid contact with individuals that may be ill, or especially kissing, hugging, or sharing utensils. Covering when you cover your mouth when you cough or sneeze, disinfecting toys and doorknobs and items that a sick child might come in contact with. There are plenty of common sense things you can do to minimize this for your children.
Okay. And children are targeted by this simply because their immune systems are underdeveloped?
No, it's not it's not so much that. It's more that they haven't seen the virus before. As adults, we've seen the majority of these things.
I see.
So we have archived immunity.
Fair enough. We'd like to have archived immunity for the flu.
Yes, that's a good point, because I want to announce to our audience that we have 3 confirmed cases in Michigan of influenza, which took me by surprise. That was announced this week. This is a preventable illness. The influenza vaccine, despite what you've heard, does not give you influenza. It cannot. It's inactive. It doesn't do that.
It is one of those myths, and we hear it every single year, don't we? Boy, when I get shot with the flu shot, I get the flu. And people think that.
If I had a penny for every time I heard that, I could run for office. I could be president of the United States.
You could afford all those commercials, couldn't
That's
you?
right. It's totally untrue. It's totally untrue. And no, your herbal remedies will not prevent influenza. Echinacea doesn't do it. A lot of people say, "Well, I've never had it." Well, no, because the attack rates in any given year between 8 and 12% of people could get infected. But you roll the dice and you live long enough, you're liable to get influenza, and it is preventable. Our technology is better than ever in terms of prevention. This year we're going to have quadvalent. That means 4 different virus particles in that vaccine, 2 Bs, 2 As, so children will have better coverage. We'll also have the high-dose vaccine for 65 and over, which is superior to the standard trivalent. I mean, superior, like 22% superior. So we have vaccines that work well, and I really encourage our audience to consider this like wearing a seatbelt. When you wear a seatbelt, there's no guarantee that you're going to walk away from an accident, but it reduces your risk of injury, hospitalization, and death, just like the influenza vaccine does.
Okay, that's a good way to put it. Folks can wrap their minds around that.
Yes.
Now, you mentioned children and those over 65 because they generally are at greater risk. Is that a fair way to say it for influenza?
Yes. Actually, everyone thinks, the old elderly population is at risk. That's true. But people under age 2 are at high risk for hospitalization as well, and you can get vaccinated down to 6 months. If you have a child who has a comorbid problem like asthma, influenza will just wreak havoc on that child. There's no reason for that to happen. And one way to prevent influenza from getting good traction in your community is get a lot of people vaccinated. It has a hard time moving through the community when there's less targets to hit.
Right, fair enough. And so folks who are middle-aged, like me, generally healthy, we could still benefit from the flu shot, too.
Well,
right?
if you don't want to miss work, you don't want to have aches and pains, you don't want to have to go to a doctor and pay your co-pays. There's plenty of corporate data from General Motors, from Kaiser Permanent, that show that when their employees get vaccinated, it saves them money because they don't get sick.
Not out as much.
They're just there's less problems.
All right, and so there are ways in our community even to avail ourselves of flu shots, and I believe that information is on the website from Bronson Battle Creek, and you can
Yes.
check that out. So should we have already gotten the shot by now, or is any time now good? What's your
Oh,
thought?
I think now we should get it. I was shocked that we had any cases at all.
Mm-hmm.
This is early, and you need about 2 to 4 weeks to mount an immune response. People forget that. They say, I got my flu shot, didn't work, got ill. It may have been another illness. For instance, children, they could get D68 instead, and that vaccine doesn't prevent that.
Right.
But now that we might have some circulating strains, it's a good time to get it right now, and we have it at Bronson Battle Creek. We have it at the health department.
Mm-hmm.
We have it at places where you can get this, and we like to make it convenient and easy for you to get it.
Right. So if somebody gets the flu shot and then they think they get the flu, like you said, it might be something else, or maybe that was already brewing before they got the shot.
It's possible. It's possible,
Okay.
especially the former. There are a lot of respiratory viruses circulating. It's also possible that there could be a vaccine failure. That is, they really got exposed to it and they got some illness. Again, it's like a seatbelt. We're not advertising 100% efficacy. We're not saying that you wouldn't have a bump in the road. We're saying that what you get is much less, and it bears over time. It protects you over the long haul.
All right, fair enough. Dr. Gregory Harrington is with Bronson Battle Creek and the Calhoun County Chief Medical Officer. Thanks so much for the time today. I'm sure we'll be in touch with other questions as time goes on.
Hey, I'd love to answer some for you.
Good. Well, we'll
Thank you.
do that. Thanks so much.